Hey viewers, I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we will be going through the 5 heart attack signs in men that you should not ignore. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Did you know that heart disease is one of the most common things killing men today? According to research, it affects 1 in every 3 men. Now you might be thinking that a disease so serious would have some warning signs. However, people can develop heart disease without having a clue. They are just minding their business and bam, it happens. Heart attacks are that sneaky. In today's video, we'll talk about the potential signs and symptoms of a heart attack in men. Is chest pain a sign? What about sweating? What kind of pain in my upper body do I need to look out for? We're talking about all of this and more. Number 1. Upper body discomfort. Knowing the signs of a heart attack can save your life. Your ability to recover from one of these events depends on how quickly you receive treatment. Upper body pain is one of the most frequently neglected signs of a heart attack in men. Now I will say, this pain in your upper body can happen for a number of reasons. Maybe you lifted something a little too heavy, and your muscles are paying the price. If you're feeling intense pain in several areas at once, this is when you need to worry. Especially when the pain is constant. Pain or discomfort may spread beyond your chest, to your shoulders, arms, back, neck, teeth or jaw. Men can also experience upper body pain with no chest discomfort. A study showed that men have lower scores than women when it comes to their knowledge of cardiovascular disease. Poor understanding of the warning signs was significantly associated with age, gender, exercise schedule, and unhealthy lifestyle. Many people think that a heart attack is sudden and intense, just like in the movies where a man clutches his chest and falls over. The truth is that many heart attacks start as a mild discomfort in the upper body. Many times men who feel this kind of warning sign aren't sure what's happening. This discomfort may even come and go. Even if you're not sure it's a heart attack, you should still talk to a doctor. Have you ever dealt with upper body discomfort? Was it a warning sign for anything? Sound off in the comments section and start a conversation with our Lovers of Good Health community. Number 2. Vital exhaustion. This term may be a little confusing. Of course, we've all felt exhausted. Some of us feel it all the time. Vital exhaustion is a little different. Vital exhaustion is a term used to describe a general feeling of sluggishness or lack of energy. You also feel highly irritable. It's not quite the same as being tired and lazy. Vital exhaustion is something that stems from numerous health problems. These range from not so serious to severe. Vital exhaustion comes from a man's unhealthy lifestyle. If you eat poorly, you're going to feel this way eventually. According to a recent study, men experiencing vital exhaustion are more likely to have a heart attack. If you don't take the proper steps to improve your health, a heart attack is coming. This is why you need to talk to a professional. They can assist with diagnosing your fatigue and then work with you to manage it. If this exhaustion comes with pain in your upper region, including your chest, back and shoulders, get to a hospital. Things may turn ugly very soon. It's sad to know that each year approximately 1,000 deaths from heart disease and stroke are preventable. Regardless of whether patients show signs of heart disease or not, there are things that they can do to decrease the danger of having a heart attack in the future. It all depends on how you're living your life. Looking for the answers on all the latest health and wellness news? Hit that subscribe button and join our followers. Stay up to date on all of our great Lovers of Good Health content. Number 3. Sweating. We've all had those moments where we start sweating uncontrollably, whether it's from a hot room or a heavy workout. Sweating is not just brought on by body temperature, it can also be triggered by our emotional state. The most common areas of sweating on our body include our armpits, face, palms and soles. Sweating in normal amounts is an essential bodily process. If you don't sweat, your body will only get warmer, but you have to sweat in the right amount. There's dangers to both sweating too much and too little. Sweating can be your body's way of telling you that a heart attack is around the corner. If you're also feeling chest pain, dizziness and shortness of breath, you should be concerned. Research shows that sweating during physical activity is healthy. Hot weather will also cause this, but when men begin to sweat while experiencing discomfort in their chest, arm, neck or jaw, a heart attack may be on the horizon. Number 4. Lightheadedness. Have you ever felt a little too dizzy? I mean, there's a strong chance you have lightheadedness. Dizziness is the third most common medical complaint seen by doctors in primary care. It affects more than 20% of the general population. Dizziness is the feeling that you might faint. You get all woozy, as if you can't control yourself. Your body may feel heavy and your head very light. Your vision may also become blurry. This usually comes with a loss of balance. While it's not always a cause for concern, dizziness can generally indicate an underlying medical condition and might increase your risk of falling down. This is why you should always be cautious when you feel lightheaded and keep track of how often you're feeling this way. Dizziness usually happens when you move quickly from a seated to a standing position. This change results in less blood flow to the brain. With your blood pressure out of balance, you're going to feel like you're about to faint. Research states that 4 out of 10 individuals have experienced dizziness severe enough to send them to a doctor. Also, lightheadedness along with other heart attack symptoms ought to be treated as soon as possible. These symptoms include facial drooping on one side, nausea, sweating and vomiting along with the usual chest pains. Remember, you shouldn't drive yourself to a hospital if you experience any of these symptoms. You could kill yourself and others. It's better to just call an ambulance. Number 5. Chest pain. We've mentioned this a couple times, but it's good to talk about it in detail. Chest pain is the most common symptom of a heart attack in men. Most often it starts slowly with only mild discomfort. Men need to call an ambulance ASAP if their chest pain is sudden. If the chest pain is accompanied by any of the other signs we've talked about. There may be other reasons for the pain. Chest pain is a common complaint in all healthcare settings, with one of the more relevant causes being coronary heart disease. If someone you know experiences unexplained chest pain on the regular, book an appointment with a doctor as soon as possible. It's highly likely they have an unknown heart condition. Most heart attacks involve pain or discomfort within the center or left of the chest. Chest pain will sometimes last for a few minutes. It normally goes away and comes back when you least expect it. This is why it's good to get the proper amount of sleep. Remember that heart attack symptoms in men and women are usually different. 50% of men with heart disease don't even know they have it due to the lack of symptoms. The sudden onset of severe symptoms is typically known as a Hollywood heart attack. This is because of the way heart attacks are shown in movies and television. A heart attack can happen this way, however, there's usually more to it. It's tough to know if you're experiencing heart attack signs or something else entirely. Get immediate medical attention if you think you're experiencing any concerning symptoms. Men who have already had a heart attack should make sure that they take all the medications prescribed by their doctor. If the doctor placed cardiac stents to keep their heart vessels open or performed bypass surgery on their heart, taking the medications are important for preventing the attack from happening again. Schedule regular checkups even if you think you're in wonderful health. Establishing a baseline for your health can assist you and your doctor in addressing any complications that arise in the future. Have you or anyone you know experienced any heart attack signs? Let us know in the comments below. Thanks for your time, and see you on the next one. Don't forget to subscribe and like the video for more contents like this one. Bye for now. Your liver does a lot of things to keep you healthy. It is especially important, as it acts as your body's filter to clear out toxins. This includes clearing the blood of drugs and other poisonous substances such as ammonia. Liver produces bile, which helps to carry away waste products and breaks down fats in the gut during digestion. It also produces certain proteins for blood plasma and other important molecules such as cholesterol, which are especially important for transport of vital nutrients throughout the body. The proteins that are produced by the liver play numerous important roles in our body. Additionally, but equally important is its role in maintaining our body's energy level in the form of glucose. It converts excess glucose into glycogen for storage. This glycogen can later be converted back to glucose for energy. This is important for our body's survival and helps us feed hunger and stay active for extended periods of time. Hey viewers! I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we will be taking a look at few signs and symptoms that you can develop if you have a liver disease. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. You may not know it, but the liver has an important role in resisting infections also. This is because the liver makes numerous immune factors to fight off microorganisms, and also removes bacteria from the bloodstream, keeping us healthy. Some factors like heavy consumption of alcohol, chronic viral infections, and eating an unhealthy diet for too long, or overdose of commonly prescribed medications can cause liver damage. Other factors that may increase your chances of getting liver disease include obesity, type 2 diabetes, tattoos or body piercings, drug abuse, exposure to other people's blood and body fluids, unprotected sex, exposure to certain chemicals or toxins, and a family history of liver disease. When some of these risk factors are present, your liver may get stressed out. This will lead to liver injury, which can present in various peculiar yet vague signs and symptoms. According to experts, very few people actually know when liver is failing. This is because most of the people aren't aware of what causes liver failure. And even lesser people know how to look out for the symptoms. So let's take a look at some of the common signs and symptoms of liver injury or liver failure. If you see one or more of these signs, you should immediately consult a medical professional to rule out any underlying disease. Number 1. Loss of appetite. A disinterest in food, loss of appetite, and weight loss are some of the early symptoms of liver problems. Number 2. Fluid retention. Fluid retention is also one of the most common signs of liver disease. It appears in more than 50% of people who have cirrhosis, a condition in which scar tissue replaces healthy liver tissue. Accumulating fluid may cause distension of your abdomen, also known as ascites, or may lead to swelling in your legs, known as edema. This happens because due to long-term liver disease, high blood pressure develops in your liver veins. This also happens when your liver is unable to make albumin, a protein that prevents the leakage of fluid from your bloodstream into the adjoining tissues. Both of these factors lead to eventual fluid leakage from your blood vessels and fluid accumulation into your abdomen or under your skin. Treatment options for fluid retention include a low-sodium diet, which helps to treat mild fluid retention. For moderate to severe fluid retention, your doctor may prescribe certain medications known as diuretics, which help in removing the excess fluid from your body by increasing your urine output. But in some severe cases, your doctor can advise a procedure known as parasynthesis, using a needle, doctor perform parasynthesis to drain the excess abdominal fluid, which leads to temporary but instant relief. Number 3. Jaundice. Jaundice is a condition that causes darker urine and a yellowish tint in your skin. It can also lead to yellowing of whites of your eyes, also known as sclera. It appears when bilirubin builds up in your bloodstream. Bilirubin is a pigment that forms when red blood cells are broken down. Usually a healthy liver absorbs bilirubin and converts it into bile. This bile is then excreted by your body with your stools. But a diseased liver is unable to do so, hence yellowish bilirubin accumulates in your body and causes yellowish discoloration of skin, eyes, and urine. You may ask, what are the treatment options of jaundice? Well, that basically depends upon the reason why jaundice has developed in the first place, and there can be a wide variety of reasons. Your doctor will evaluate you by performing different types of tests like a complete blood count, liver function tests, ultrasonography of your liver, and liver biopsy if needed. Number 4. Increased tendency of bleeding. A healthy liver produces clotting factors, which are basically proteins that are activated whenever you are injured. These proteins lead to formation of a blood clot which stops the bleeding. An unhealthy liver leads to a decreased production of these clotting factors, which ultimately results in an increased tendency to bleed. So whenever you are injured, it takes a longer time for your body to stop the bleeding. You may also experience bruises under your skin with minor trauma. Patients with advanced liver disease, such as liver failure, have very low levels of these clotting factors and can experience episodes of spontaneous bleeding without any injury. These patients may bleed into their stomach, which results in blood in their vomit, or they can even experience bleeding in their lungs, which can result in blood during coughing. Liver cirrhosis leads to an enlarged spleen known as splenomegaly. Our spleen has a job of collecting platelets from our blood and their storage. When spleen gets enlarged, excessive amounts of platelets are removed by the spleen from a blood. This phenomena is known as splenic sequestration. This may lead to a very low platelet count, which makes you more susceptible to nosebleeds and bleeding gums. Number 5. Confusion. Your liver is the major purifier of toxins from your blood, and it also metabolizes a lot of chemicals we ingest, such as those present in our food and medicines. When your liver is unable to filter these toxins, these may travel and accumulate in your brain. The resulting condition, known as hepatic encephalopathy, can cause confusion, memory problems, lethargy, and in later stages even coma. Number 6. Frequent nausea and vomiting. This also results due to liver's inability to remove toxins from our blood, which slowly build up and trigger certain areas in our brain. That results in nausea and vomiting. In our upcoming videos about liver health, we'll talk about what are the common reasons of liver disease. And we will also make a video on how to keep your liver healthy. So make sure to subscribe to our channel so you don't miss out on those videos. Well, friends, we at Lovers of Good Health believe that you should never ignore symptoms. Always consult a medical professional if you see any of these above symptoms. With this, we come to an end of this short video. Do remember to share this video and press the like button if you like what we do. Consider joining us on our YouTube channel by becoming a member. Thank you and take care. See you in the next video. Hey viewers, I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we will be going through the 7 things your face says about your personality according to science. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Have you heard the saying, the face is the index of your mind? Well, if you think about it, it's true. There are certain things that our faces say about us. Researchers believe that our faces can tell others about our personalities, health, and mental state. In today's video, we're talking all that and more. Number 1. Arty versus analytical. Many people believe that one side of their face looks better in photographs than the other. What if we told you that it says a lot about the way our brain's wired? Our brain has two hemispheres, each serving a particular purpose. The left hemisphere controls the right hand along with our ability to solve problems, think logically, and analyze situations. Whereas the right hemisphere controls our left hand, as well as our ability to imagine things, form ideas, and affects our visual perception. According to studies, artists, scholars, poets, and musicians prefer to pose with their left side of their face. On the other hand, mathematicians, scientists, businessmen, and engineers prefer to pose with the right side of their face. There's so much more our faces can tell us though. Number 2. Food habits. Our face can also display the types of food we consume. For example, if you've been eating a lot of carrots lately, your face may have an orange glow. The same can be said about other foods. Each and every food affects the face in a different way. Calcium-rich foods tend to make the skin clearer, whereas, if you get pimples, you haven't managed to digest your food. If you're allergic to something and you eat it, your face may even turn red. This is because your skin absorbs everything you eat just like the rest of your body. Number 3. Confidence. One of the most common things that's often noticeable on your face is confidence. When you're confident, your face tends to glow a little. As a result, it's very easy to distinguish. Similarly, when you're nervous, your face becomes a little dull. One thing to keep in mind though, this is usually not applicable to people who are not expressive. Introverts aren't usually very expressive. No, they aren't trying to be tough, they just aren't that way. For them, expressing emotion could be a bit difficult, apart from that others may display a smile or have a glow on their faces. This is an indication that they are very confident. Number 4. Sexual drive. Facial features can also tell you a lot about a person's sexual drive. For example, if you happen to have bigger cheekbones or a wider face, you have more sexual drive. While experts are divided on their opinions on whether or not they are more aggressive, we can say for sure that they may be more passionate. If they can convert that passion into drive, they'll achieve a lot of success. They may also be more dynamic and assertive. As such, they may be suited for leadership roles in their social circles. They'll also be seen as very reliable. Apart from that, some experts think of it as an evolutionary benefit. They believe that having more sexual drive means that a person would be more capable of handling conflict. A certain case study we could mention here is of our distant relatives, capuchin monkeys. In their groups, monkeys with wider faces have higher status, while monkeys with narrow faces are of lower. Number 5. Chins. Some studies have concluded that extrovert people have a protruded chin, while people who are introverted didn't. There haven't been any proper scientific findings regarding this. It's just common characteristics observed among extroverts. In many cases, it's also seen as a sign of charisma and confidence. Whoa! Who would have thought that our jawline could tell us so much? The jawline isn't the only thing though. Even your eyes can tell you a few things about your personality. What are those things? Number 6. Shape of your eyes. If your face is the index of your mind, your eyes are the windows to your soul. Psychologists agree that your eyes can speak volumes about your personality. People with round eyes can be very sensitive. They are also very impulsive at times. People with big eyes tend to be very introspective and philosophical. Meanwhile, people who have wide-set eyes tend to be bold in their personality. People like this are usually willing to try new things. They also like to take a lot of risks. People who have almond-shaped eyes tend to be passionate. They either like to be completely involved in something or not involved at all. They are also very down-to-earth and humble. Meanwhile, people with downward slanting eyes tend to be a little pessimistic. Number 7. Color of your eyes. First we spoke about the shape of each eye, now we'll be talking about the color. Since there are many different eye colors, we'll have to touch on them one by one. Let's start with blue. Blue is one of the rarest colors for the human eye. There have been many speculations about it. Many cultures even embrace it by saying it's godly or angelic. As far as psychology is concerned, blue-eyed people are usually a bit more reserved. They like to keep to themselves and not engage in too many social activities. On the other hand, once they open up to you, they'll be very friendly. Most people with blue eyes are also very anxious. Green. We don't know if jealousy is really a green-eyed monster. We do know that green eyes are beautiful people. With this eye color, are easy to get along with. They are also very confident. A trait that is mostly common among people with brown eyes. One thing they have in common with blue-eyed people is they prefer to keep to themselves. Another interesting thing to note is that green is one of the rarest eye colors. In that sense, green is the opposite of brown, which is the most common color. Brown. As we mentioned, you're more likely to meet a person with brown eyes than people with any other eye color. People with brown eyes also have the most amount of melanin and content in their body. Brown-eyed people are easygoing and easy to talk to, while they may or may not necessarily be extroverted. They are friendly people. With this eye color, also have a stronger immune system and better metabolism. Hazel. Those with hazel eyes are somewhere between green and gray. They have the characteristics that are common in green, while others are common in gray. For example, they can also be a bit outgoing and confident, while on the other hand, they can also show signs of nervousness and anxiety. Hazel is one of the most unique colors. Individuals with this shade have a tendency towards being a little unconventional and unorthodox. Gray. If you've ever met a gentle soul, you've probably met someone with gray eyes. These are very nice people to have around. They are friendly and can get along with anyone. Apart from that, they are also very optimistic and full of hope. Gray-eyed people are very sensitive. As such, they are also very polite and avoid offending others. On the other hand, they can be very cold-hearted when they've been angered. So what does your face say about you? Let us know in the comment section below. We would love to hear from you. Thanks for your time, and see you on the next one. Don't forget to subscribe and like the video for more contents like this one. Bye for now. Hey viewers. I'm Dr. Sophia Fahl and welcome to Lovers of Good Health channel. In today's video, we will be going through what your skin says about your health. But before we begin, kindly use some of the time to subscribe to this lovely channel and leave us a like on this video to support the channel. Thanks for doing that. Now let's begin. Everyone wants healthy glowing skin, but are you working towards getting the glow you desire? Did you know your skin can reveal dark secrets about your health? It's true, just by looking at your skin, experts can tell if you have problems. Pretty wild, huh? In today's video, we'll be discussing various things your skin says about your health. Can it signal polycystic ovarian syndrome? What about high cholesterol and diabetes? We'll be talking about all of this and more. Number 1. Polycystic ovarian syndrome, or PCOS. You might be hearing a lot about polycystic ovarian syndrome, PCOS, recently. It affects the hormonal levels in women and has become a pretty common disorder these days. Ladies, did you know your skin can be a window into what's happening inside your ovaries? You heard that right. Among the many symptoms of PCOS, such as irregular periods and weight gain. Your skin also gives signals. The most common being acne. Not all acne is signaling PCOS. The cystic ones can be a red flag. If a woman has PCOS, then there's a high level of male hormones called androgens, which stimulate the production of oil in the skin. Excess oil secretion leads to acne not just on the face, but on the back, neck and chest as well. Along with acne, dark patches of skin can form in body creases like those on the neck, in the groin and under the breasts. Hold on, there's more. Excess hair growth on the face and body, including hairs on the back, belly and chest, are also a sign of PCOS. While you have extra hair growing on your body, you might be losing it from your scalp. Thinning of hair is another major symptom of PCOS. Do you or someone you know have PCOS? How are you battling cystic acne? Sound off in the comment section below and start a conversation with our Lovers of Good Health community. Number 2. Liver disease. Did you ever think that your skin condition would indicate the health of your liver? If you've ever heard of jaundice, you'd know your skin and the whites of your eyes turn yellowish. This is a sign of jaundice and can be a signal of hepatitis C. Itchy skin is pretty common during the winter, but if it lasts for more than 6 weeks, it's an indication of liver problems. Itchy skin can be an early symptom of cirrhosis or hepatitis. Bumps, rashes and itchy skin are some of the first signs of hepatitis. You might even notice red marks on your legs. Number 3. Hyperthyroidism. If you've tried all sorts of moisturizing and your skin is still very dry, it can be a sign of hyperthyroidism. It affects your skin in various ways, making it coarse, dull, dry, pale and thin. Your skin may appear ashy and very scaly due to intense dryness. Another sign of hyperthyroidism is brittle nails. If you have thin nails that break easily along with dry, dull, and coarse hair, you should get your hormone levels tested. You may also notice thickening of the skin on your calves. All these skin issues will go away with proper thyroid treatment. Number 4. Allergies. Your skin is the first to signal any kind of allergy. The most common sign of allergy is itching. If you suddenly have intense and unbearable itching, you might be suffering from an allergic reaction called hives. These are itchy welts on the skin. Hives are reddish in pink in color and can sometimes sting or hurt. It's often an allergic reaction to something you've touched or swallowed. This can be food, medicine, pollen, pets, or an insect sting. If you ever experience a sudden outbreak of itching and you see reddish welts on your skin, seek medical help immediately. Feel like you're missing out? Make sure you join our viewers by hitting that subscribe button and staying up to date on all our great Lovers of Good Health content. Number 5. Lymphoma. As sudden itching may indicate an allergy, persistent itchy rashes can signal lymph node cancer, also known as lymphoma. We know it's a bit shocking. Rashes are the most common symptom, particularly for lymphoma of skin. These may occur as reddish or purplish scaly areas and are common in skin folds. Itchy rashes spread as lymphoma progresses. You may even notice lumps or nodules on the skin, which are also a sign of lymphoma. While itchy rashes are common in Hodgkin's lymphoma, it's less common in non-Hodgkin's lymphoma. The itchiness can be so severe it can affect your quality of life. As the lymphoma advances, the itching becomes worse. If the rash does not settle on its own after 2 weeks, you should visit your doctor. Number 6. Shingles. Have you ever had chickenpox? Well, that same virus can cause shingles. This viral infection is marked by a red skin rash that can cause pain and burning. The early signs of shingles are pain and burning on one side of the body, followed by a red rash. Depending on your skin tone, the rash may appear dark, pink, dark brown, or even purple. You'll notice blisters on one side of your body, particularly on the torso, neck and face. A rash on one side of your face means shingles on the face. In severe cases, rashes can appear in your ears, which can create serious complications, like loss of hearing and issues with your balance. You may even observe swelling and redness around your eyes along with blistering rashes on your eyelids with burning. All these indicate shingles of the eye which need treatment ASAP. Number 7. Diabetes. Diabetes has become pretty common these days among its many symptoms, including extreme fatigue and frequent urination. Your skin is also giving away signals you might ignore. Yep, your skin is affected by high blood sugar levels in several different ways. To begin with, if you see light brown, almost circular scaly patches around your shins, it indicates elevated levels of blood sugar. These patches are called shin spots. High blood sugar damages the small blood vessels that supply oxygen and nutrition, which results in these shin spots. If there are large circular patches with a red or violet border on your skin, particularly on the legs, it's a red flag for diabetes. You may feel pain and itching in these patches. Another important and common signal for high blood sugar is a dark tan patch of velvety skin on the neck. It can also occur on the armpits, elbows, knees and groin. These velvety patches typically affect people who are obese. Your skin on the hands, fingers and toes may become waxy, tight, thick and stiff on the joints, which is also known as digital sclerosis. Elevated blood pressure levels can lead to poor circulation and nerve damage. It becomes hard for your body to heal wounds. You should check your feet regularly, as they may develop open wounds called diabetic ulcers, which are sometimes difficult to heal. High blood sugar levels overall reduce your skin's ability to fight infections. If you see random cuts or sores, especially on the feet, you need to get your blood sugar levels checked. In addition to skin health, there are other signs of diabetes you need to look out for. Number 8. High cholesterol. Your skin can tell you if you have high cholesterol. How the cholesterol in your skin forms yellowish bumps known as xanthelasma. These yellow deposits are usually found around your eyelids and are a side effect of high cholesterol. You may see yellowish white lumps of fatty material collecting under the skin around your upper and lower eyelids. This cholesterol deposit might affect your ability to blink, as well as open or close your eyes. This is a warning sign of elevated cholesterol levels. Getting proper treatment on time can save you. Number 9. Lupus. Skin rash is very common, but if it's accompanied by round lesions, this can be a signal of cutaneous lupus. Cutaneous lupus is a chronic autoimmune disease which primarily affects the skin. You'll probably notice coin-shaped lesions on your skin as well. The skin rash is very severe and may look red or pink. Rashes can appear anywhere on the body, but more commonly on the scalp, neck, hands and feet. Sadly, sun exposure can make these rashes even worse, so it's very important for people with lupus to apply sunscreen with an SPF of 70 or more before going out in the sun. Another sign of cutaneous lupus are thinning and peeling of the skin, thick scales on the scalp, blistering lesions on the elbows and fingertips, and skin pigmentation. Did you know about these skin signals before watching this video? Let us know in the comments below. Thanks for your time, and see you on the next one. Don't forget to subscribe and like the video for more contents like this one. Bye for now.